Now, various types of birth control methods, they are used to prevent the population explosion. These birth control methods are called contraceptive devices or the contraceptives. Devices which are used to control the birth of an individual, they are called contraceptives. These methods or devices, they are divided into three categories: the barrier method, chemical method, and the surgical method. In barrier method, there are physical devices which prevent the entry of sperm in the female genital tract during copulation. And these barrier methods, first of all, they prevent the entry of sperm into female genital tract. Second, these barrier methods, they also protect against STDs, that is sexually transmitted diseases. Examples of the barrier methods are femidome, cervical caps, which are also known as diaphragms. These are used by females. Now, the second category is chemical methods. In chemical methods, some tablets, which are also known as pills, jellies, paste, or creams are used. These jellies, paste, and creams, these are also called spermicides because they kill the sperms. So, the jellies, paste, or creams, which are also known as spermicides, they kill the sperms when applied on female genital tract. And the pills are the tablets which contain, these pills, they contain female hormones like estrogens and which check ovulation, that is release of egg from the ovary into the fallopian tube. This process is controlled by these pills, and this is also called oral pills or oral contraceptives. Examples of the chemical methods are, there are certain pills like Malady. These are the pills which are to be taken on daily basis. There are improved pills also. For example, Saheli. This is once a week tablet taken by the females in order to avoid the birth of a child. These also include IUDs. IUDs stands for intrauterine devices. Example of IUD is copper T, a T-shaped device which is inserted in the uterus, and this also prevents the fertilization. And these IUDs, they are either made up of plastic, copper, or stainless steel. These can avoid implantation and can be used at a stretch for 2 to 2.5 years at a stretch, and there are improved varieties of copper teas, they are also available, which can be used at a stretch for 7 to 8 years, and example is multilode. Now, the third category of contraceptives. These are the surgical methods, that is by surgery, by some small surgical operations. the pregnancies, they can be avoided permanently. Surgical operations in males to avoid the birth of the child, these are called vasectomy, and in females this surgical method is called tubectomy. In vasectomy, it involves removal of small portion of vas deferens through operation. The vas deferens, the ends of the vas deferens, they are cut and tied. Vas deferens, it is cut and the two ends they are tied, and this prevents the sperms from coming out. Similarly, in tubectomy, it is the surgical operation performed in females. It involves a removal of a small portion of fallopian tubes. The fallopian tubes, they are also cut and tied, and this prevents the egg to enter into the fallopian tube. Both vasectomy and tubectomy, they are known as the methods of sterilization. These are called sterilization also. So these are the birth control methods or the contraceptive devices.